Okay, welcome. Great to see you all coming in. Hello. All right, wonderful. Everyone's in. Everyone's getting settled.
Oh,
All
it's
right,
really
my name is
nice
Heather
that you can feel
McDougall.
that.
I'm the CEO of the McDougall Program, and I'm John and Mary's daughter. And we thought this would be a fun opportunity to check in with you and give you some time to get to know us. We do something like this quite often during our 12-day online course, and this won't be nearly as intimate, but you'll still have a chance to ask us some questions. So welcome, Mom and Dad. I'm glad you're here.
Oh, thank you. Thank you. Good. We're glad to be here too, Heather. You know, we love to talk to people. We love to share our information. You know, Mary and I have been at this for 46 years. We've been married more than 50. And there's nothing that gives us more enjoyment than to see people pick up our message and get their health back and get their appearance that they've lost back. So, you know, many people sign up for our 12-day program. And as a matter of fact, the only advertisement we're going to do during these 5 o'clock sessions every Sunday night is tell you about the 12-day program, because that's the ultimate way to get fixed. So we'll be talking about that, but otherwise, there are no commercialist interests here. And just to give you a little history, Mary and I learned about this kind of eating when we were on a sugar plantation on the big island of Hawaii. And we were taking care of first, second, third, and fourth generation Filipinos, Japanese, Chinese, and Koreans. And what I discovered was that my first generation, who lived on starch, rice, few vegetables, you know, a few of them got lucky catching a fish. And the only time they had chicken is when they got unlucky and lost the cockfight on Saturday afternoon. Otherwise, they ate a diet of rice and vegetables. Same thing with my Korean, my Chinese patients, my Japanese patients. And I had a chance to take care of them. They aged gracefully. They never had breast cancer or prostate cancer or heart disease. They were never overweight. They worked hard on the plantation until they were in their 80s and 90s. And that was an inspiration for me. And I wanted to learn more about them, especially when I saw their children and grandchildren became more overweight and more sick as they adopted the Western diet. So, you know, what I'm going to teach you, and Mary is going to help you learn, are some really basic principles. If you open your eyes, you'll see it. You know, like one of our major principles is the McDougall diet is a diet based on starch. You know, starch like rice and corn and potatoes and breads and pastas, with the addition of fruits and vegetables. And the McDougall program does not contain oil.
Free oil.
Any free oil. It has plenty of oil in the vegetables. Thank you, Brie. Plenty of oil in the vegetables, but it doesn't have any free oil like corn oil or safflower, because you know, you're just going to be a fat, greasy vegetarian if you keep the oils in your diet. So I thought I would start this out, Mary, and I'd start talking about it and see whether you have any questions or we're able to get your questions.
Well, you know why he's doing this? Because he had radio shows for years and years and years, and he missed having his radio shows. He used to have one every Sunday night, and he had one 3 times a week at noon.
5 days.
5 days a week at
Yes,
noon?
I guess maybe 5 or 6.
Well, I remember you doing them when we were on our ski trips. You'd take all your radio stuff into the room, and
Yeah.
you'd be doing a radio
That's
show.
before that's before they had the internet. We used to have to
Well, I think
check it up the phone
you
lines.
missed the radio
I
show.
do. I
He
miss.
likes having contact with people, and so this was the next best thing.
Yeah,
They
well,
don't do radio shows anymore.
I don't think so. The technology is so wonderful. I mean, I feel like I'm in the same room with you. But yeah, that is what I've done for 25 years, since I've had a radio show. And I was played as between number 1 and number 7 all over the West Coast, including KABC radio, which is in Los Angeles, KSDO, which is in San Diego, to many of the stations in San Francisco, all the way up to, they were in Medford, we were in one of the places in Oregon. I used to get 2,000 phone calls a night. And yeah, I really enjoyed it. And, you know, it was all free. Of course, there were commercials.
Yeah, that's what made me think of
Yeah.
it. Had commercials on the radio.
Right. Yeah, you know, it was all free.
But you just miss talking to people. He likes talking to people. So
I love it.
I think he needs that,
Well,
that
thank you.
contact with people.
I do.
Well, now that we've moved everything online, it's just being on Zoom or on YouTube. It's just so comfortable, and it's just a great way to connect with everyone.
Oh,
I've got
you know,
lots of questions coming in already.
this,
Oh,
this, is,
good.
this is so amazing. You know what? While you get your questions organized, I just want to say a couple of words about the number one health problem in this world, and this certainly in this country, in Europe, and now rising in the Asian countries, and that's being overweight and obese, and that never existed. We never had these kinds of problems. You look at the Japanese around the time of World War II, there are no overweight Japanese. Same thing with Chinese. There are no overweight Chinese until 1980. The Hispanics, they're up until 2 generations ago, they were living on beans and corn and vegetables. And grandma and grandpa were trim and healthy, and they didn't have heart trouble or breast cancer. But our Hispanic people today, they're some of the most ill people. In fact, half of them are diabetic down near the border. So it's a really serious health problem. It's so simple to solve. You just have to remember the fat you eat is the fat you wear. And there's such a drive to store fat that the body wants to do. It's really good at it. And so anytime you eat a little vegetable oil or pig fat or cow fat, that ends up being stored in your buttocks, thigh, and abdomen. So you've got to get the diet as low fat as possible. And in our diet, it's about 7% of the calories is fat. Could be as low as 1%. The fat you eat is the fat you wear. Now, if I recommend it, I am going to recommend to you, you heard me say it, that you don't eat any animal products. That means secretions of animals like dairy, or parts of animals like, you know what the parts of animals are. You don't eat those things. You think of yourself, well, what am I ever going to eat? Well, if you want to be trim, you want to lower your cholesterol and get your bowels working. You want to stop your autoimmune diseases. What you do instead of having calories come from the animal kingdom and oils is you switch to a starch-based diet. And guaranteed, you'll lose the excess weight. Now, I'm not guaranteeing you're going to stick with it, but I guarantee if you stick with it, you'll get the results you want. Cost you absolutely nothing. In fact,
It's cheaper.
yeah, you lower your food bills by, if you eat out a lot, you can lower them by 80%. And in this day and age of inflation, good grief, you want to make the food bill go as long as possible.
Big bags of rice and beans and even pasta, they're all fairly inexpensive.
Yeah,
It's just when you add all the meat products and the dairy products and the eggs, the price goes up.
Well, we don't go to Costco much anymore. We used to go to Costco all the time. And I can remember one of my last visits a couple of years back is there was a family in front of me. They were obviously, I'll just guess from Mexico or Central America. And the husband, he was about 40 pounds overweight, and the wife was about 60 pounds overweight. And each of the little kids, had 3 little kids, was likewise proportionally overweight. And she was, pushing through the conveyor belt, all the groceries she picked that day. And finally, when she got to $300, she told the lady, "Stop! You have to put the rest back." What I felt like doing, and Mary stopped me, was I felt like grabbing her and telling her, "Look, go back here. Look at this aisle. Here's 25 pounds of beans for $20. Here's 20 pounds of potatoes for $10. And then you can solve your health problems. You can look like your grandma and grandpa looked like. That's as simple as it is. As far as having any other gimmicks, even taking a walk is not, if you push it hard enough, exercise, that could be a part of a good weight loss program. But just change the food.
It just sounds so easy that people can't believe it.
Well, it's non-profitable too.
Well, I like how you talk about getting back to your traditional diets, the food that your ancestors ate.
Yeah, that's the thing, Heather. I never wanted to call, because I'm working on a lot of outside projects. I didn't want to call it the McDougall diet. I didn't want to call it a vegan diet. That scares people to think about a vegan diet. So what I've been talking to people about is I've been talking to them about this lady's name here.
Sacagawea.
Sacagawea, okay. There's Sacagawea. Oh, It's
You can see it very well.
Sacagawea.
There, right in front of the camera. There you go.
She's upside down. Probably not worth the trouble to show you Sacagawea, but there's a point to this. And that is on the other side, this coin was printed by the US government. On the other side is the three sisters. Okay, the three sisters are corn, bean, and squash. That's been the diet of not only the people in Mexico and Central America, but goes back 12,000 years to the Native Americans. You know, this is what people have eaten. And whenever they switch from a starch-based diet, if it happened to be corn and beans and squash, you know, like the Aztecs and Mayans started eating, you know, 1,300 years ago, they were known as the people of corn.
And you know what? If people go onto our website, they can actually find a recipe for Three Sisters stew.
Oh,
Yeah, I made that with rice and beans and squash.
Yeah.
And a few other things too, but they can just look it up by that name.
Well, that's another thing I want to mention is everything, pretty much everything on our website is free. So if you feel that you can't get your health back because the budget is tight, it's all free. You know, the newsletters are free. Probably buy many of my older books. So six of our 13 national best-selling books are still bestsellers, and that goes back, you know, about 40 years of writing. So you gotta admit we have a sustained effort out here. We've been doing this for so long that people don't tire of it, and the truth don't change.
I think they want you to write another book, don't they?
Do, but I don't think I will. I think.
All right, well, lots of questions coming in, so let's get to
right.
some of those. I'm not going to be able to get to all of them, but we're going to be doing this often. So let's see.
Every Sunday night at 5 o'clock.
So this is from an anonymous attendee.
Uh-huh.
Is there a difference between starch and complex carbohydrates?
No, there's no difference. This happened in 1977 with the U.S. dietary goals by George McGovern. He was the Democratic senator from South Dakota. And he set up a nutrition committee that was supposed to be like the Surgeon General's report in 1964 about cigarette smoking. He wanted to replicate that for Americans and tell them what to eat. And so they did. They came out with very clear recommendations, not as aggressive as they should have been, but you know, they told you not to eat meat, not to eat dairy products. They told you to eat fruits and vegetables and legumes and grains. Well, that
That must have not lasted very long.
February 77, they came out with that. And then for the next year, the lobbyists from the meat, dairy, and egg industry came out. And I'll tell you what they did. If you read the dietary goals, which are put out, or the dietary guidelines, which are put out every 5 years, you'll notice in the guidelines that they don't identify harmful foods as beef or pork or chicken. When they talk about these foods, they talk about cholesterol-laden foods or foods high in saturated fats. In other words, you have this gap in your understanding. And what they did is they took a common term that people were using back then. Your grandma used this term, which is starch. And they changed the term to complex carbohydrates. Industry did that. And so you think to yourself, let's see, when I go over to grandma's house, you know, she'd have mashed potatoes or, you know, some kind of cold pasta dish or corn dish or whatever. You do that, don't you, grandma? And yeah, so, you know, you understood starch. We eat starch. And but when you made a complex carbohydrate, you go out to your garden, you say, how can I identify a complex carbohydrate in my garden? Or when I look at my dinner plate, you see, they took the nomenclature away from us in the battle to sell products. And the consequence was people got overweight and sick. So yeah, they're exact same thing, complex carbohydrate and starch. It's just starch is the word that is correct. There's a journal published in German, which is titled Starch. It's where scientists, they publish the information on the commercial use of starch and the food use of starch. I think they spell S-T-A-R-C-H-E. But anyway, it's the right word. It's not complex carbohydrates. It just takes the power of the word away. So yeah, starch.
Starch is easier too.
Yeah.
Just one syllable.
Well, I'm familiar with it. And so a lot of the, the videos that I show, like when I have Dr. Dennis Burkett tell his story, he talks about starch.
Yeah.
That's people used to talk about starch. Anyway, Heather, go ahead.
Thank you. Let's see, next question is from Lily. I really enjoy the Dr. McDougall soup cups like the split pea and pad thai. However, they are high in sodium. Should I be concerned?
Compared to what? They're about 480 milligrams of sodium. And if you look at a typical, what would you call them? Korean noodle dish.
A pad thai dish.
An Asian dish. They're 1,400 milligrams of sodium. Now, these foods, which Mary and I developed this company back in the early 90s, are sold in over 6,000 stores across the country. They're about 30 different varieties, soups and stews and meals and so on. We put 480 milligrams of sodium in it, which is about a third of what the traditional cup holds. The reason we did that is because it's not called Dr. McDougall's Perfect Foods. It's called Dr. McDougall's Right Foods. And that's because I need to get you to eat it. And you're not going to eat it without the salt. Our company actually made salt-free versions of our various soups and stews and meals for the Pritikin program to sell them. And we only produced it once.
Nobody bought them.
No salt, no sale. So it doesn't do you any good if you don't love the food. And what you're missing if you don't like the food is the salt. Just take that salt shaker out, put the salt on the surface of your food, it's going to be yummy. Yeah. So later on, you'll become perfect. Right now, you just need to get well and lose the weight.
Well, and I think the great thing about at least the soup cups is that the seasoning comes in a separate packet, so you can use as much or as little as you want.
Yeah. And also, the way I think of it is that, like when I make the split pea soup, we will often use it on top of a huge baked potato as a topping. And so the potato doesn't have any added sodium. And so this is like kind of a garnish. And if you were going to eat them 3 times a day, it would still only be 1,500 milligrams of sodium. And people usually don't. It's just for a quick snack or something like that.
Thank you. Next question from Rachel. If aluminum is linked to Alzheimer's, should drinks in aluminum cans like LaCroix be avoided?
Well, I hope that's not a problem, because Mary told me that as she understands, the aluminum cans are now coated. But originally, like 10 years ago, they weren't coated, and you can actually go to an article I wrote about aluminum Alzheimer's. I wrote it in 2004. And you can look it up and you can see there's a reference to how much aluminum came out of each variety of cola. But these days they're supposed to be coated with some type of shellac so that your water doesn't get in touch with the aluminum can. But you can prove me wrong. I haven't looked it up in a while.
No, it's been a while, but I think in the beginning I read about this. And if you look at the inside of the cans, they're a different color from the outside of the cans. And I think that's the coating that they put on them.
I've written 2 articles about aluminum Alzheimer's disease. You can find them on the website. And again, everything's free on the website. And I went through a thorough discussion as to why aluminum poisoning results in Alzheimer's disease. Now, this is a big financial issue for the aluminum and the fluoride industries. They're making a ton of money, and so they try and discount everything. But the information is overwhelming and clear. It just can't be any other way than aluminum poisoning is a primary factor in Alzheimer's. And 60% of the dementia that occurs is due to Alzheimer's disease. It's entirely preventable. Described by Louis Alzheimer in 2017. So look it up. And what
hopefully the cans are still being coated.
Yeah, what he found was he found his first patient, okay, and he did an autopsy on her brain. He found these classic lesions. They're called senile plaques. or neurofibril tangles that kind of go together. And you'll learn about this if you look it up on the website. And he described these in this patient, and she had rapidly progressive dementia, just went really quickly. And then another 23 cases, similar pathology findings were reported. Then I got up into the hundreds of thousands of cases. And then they developed the electron microscope, and they were able to look into these pathognomonic lesions. In other words, if you don't see the pathology, you don't have Alzheimer's.
But don't you have to be dead to do that?
Yeah.
So then how would you know if you have Alzheimer's until after you're dead?
You want to assume so, because they have to put you under an electron microscope, and that's not the way you want to go. But anyway, when they do that, when they do that with cadavers, and they section their brains and they look with an electron microscope, what they find is that the senile plaques have a central core of aluminum silicate. Listen, if you don't have the central core of aluminum silicate, you don't have a senile plaque. If you don't have the senile plaque, you don't have Alzheimer's. Now, there's some evidence that you could take the aluminum out of the body. There's a drug that would have been popular, except it didn't make drug companies any money. It's called Desperoxine. And it's an aluminum chelator. And it grabs the aluminum in the body and in the brain. It actually, slows or stops the progression of Alzheimer's. People don't go back to what they used to be, but it slows or stops the progression.
That should be much more well known than it is.
Yeah, I know.
Because there's a lot of people with Alzheimer's.
I know, Mary. It's just unbeknownst to me, except for the fact that it brings nobody any money, so they're not going to put it in their advertising budget.
Well, that's
not going to tell people about it. When you look it up, desperoxine and Alzheimer's disease, you'll find a really, really interesting story. Anyway, there are silica drinks that you can buy that also are aluminum chelators. These are waters, SILICA, silica. And you can also buy silica teas. And both of these remove aluminum from your body. They're aluminum chelators. They're safe. I didn't see any reason you wouldn't want to start on it now because, as Mary said, Alzheimer's is so common. It's due to aluminum poisoning.
So you go into this in great detail in our new anti-aging mini course.
Oh yeah, that's right. I just put together two 1-hour lectures that Heather is promoting right now, and it's about aging gracefully. And it tells you how to live about 30% longer. You're going to die, but you're going to live 30% longer. And it tells you how to preserve your mental function with some really interesting CAT scan studies where they showed when you eat more in the direction of the diet we recommend, that your hypothalamus, which is the area of the brain for learning and memory, if you eat like we do, the hypothalamus stays large.
Oh, I remember the slide that shows that.
Yeah, and it's in this package that Heather, I don't know whether you want to tell them a lot more, but I want to finish the story. Anyway, people eat the Western diet, the meat and the dairy. When they follow their CAT scans on looking at the hypothalamus, deep in the brain, they find that there's atrophies. And that goes along with the loss of mental function. So the science is solid, absolutely solid on how you live longer, maybe 85, 90, 95 years old. I would think that's possible. Since we're both around 75, we kind of keep pushing the limit up there. And also, you follow these suggestions, you avoid aluminum, and you don't want to get Parkinson's. I just told you how you get Parkinson's, or I didn't. No, you get Parkinson's from organophosphates, from pesticides. And anyway, you got a chance. You got a chance, and it's worth learning about. I put months of work into this presentation.
Yeah, that's true.
Yes, and you can find out more by visiting our website, and it goes into the talks in detail and just everything that's in the mini course. I worked too hard on that one, Dad. But it's well worth it.
I enjoyed it. I have another one coming out as soon as you and I get around to recording it. It's unattractiveness. How to be attractive to other people, whether it's platonic relationships like school or business, or it's sexual relationships for reproduction. And this tells you all the things you can do with your diet to change your attractiveness. And basically it comes down to is health is attractive. Health is attractive.
And there's so much information on attractiveness that you have to do it in two separate lessons.
We have 2 lectures on that coming out too. So, you look at somebody and you look at the slant of their eyes or the crookedness of their nose, or one cheek is higher than another. Doesn't matter. But you look at somebody, you look for healthy people, because healthy people are so much more productive. And you don't want to share your sperm and your ovaries with unhealthy people. You want to have the best person possible to make this important event in your life, to produce the most fit offspring.
Well, and employers are also looking for healthy people.
Yeah, you get paid less if you're overweight or diabetic. Less chance of being hired for a job. You get less chance of getting accepted at college. Your on subjective essays, you're graded lower if you're unattractive. And by the way,
that's really terrible.
Yeah, well, it's just prejudice. We have laws, Mary. We have laws against bias against people because of their gender or their age, and all kinds of things. Their race. You're not allowed to do that. But we don't have a law against being biased against people because of their attractiveness or lack of. So, anyway, you got a double shot there, Heather.
I know, lots of new projects we're working on. It's been lots of fun. Okay, next question. We are clearly not going to get to all of these, but like you said, we're doing this every Sunday, so lots of chances to answer these questions. Someone anonymous again, please explain in layman's terms how it's the oil, not necessarily the sugar, that's the issue with type 2 diabetes.
Okay, well, it's a matter of getting fat. What happens, type 2 diabetes is just an adjustment for your survival. The body will allow you to gain 30, 40, 50 pounds in late fall, late summer, or early fall when the crop comes in, so that you can make it through the winter. It's okay to gain 30 or 40 or 50 pounds, but it's not okay to gain 100 or 500. So what you do is the body develops naturally insulin resistance because you're just too fat. Now, the easiest way to become too fat is with oil as opposed to sugar. Sugar is 4 calories per gram. By the way, starches are only 1 calorie per gram. So they're really calorie dilute. A starch like a potato, that's pure sugar plus water plus fiber plus a bunch of other things that make a potato. Oil is 9 calories per gram. So it's the most concentrated of all calories. Plus the body burns off extra carbohydrate. Sugar even, plain white sugar. If you increase the amount of sugar in your diet, like by 35% of the calories, increase it. It takes you 4 months to gain a pound. The body just burns up that carbohydrate, but it doesn't burn up fat. The fat you eat is the fat you wear. I can tell what you like to eat by taking a needle and, putting the needle in your buttocks, thigh, or abdomen, suck the fat out, and I can take it to the lab and analyze it. If you're full of omega-3 fats, then you're a big fish eater or a flax oil eater. You're full of trans fats, you remember margarines and Crisco's. That's what I'm going to find. You're full of monounsaturated fats, well, you're a big olive eater. And dairy products, C17, C15 fats. Anyway, it just goes like you've heard the saying, from my lips to my hips. It's the metabolic dollar that's being stored for the day when no food's available.
Yeah, but you didn't tell them about fat and sugar and insulin.
Is that what the question?
Yeah.
Well, that's my talk on diabetes.
Well, everybody thinks that sugar causes diabetes.
And all we hear is that paralyzes the insulin.
Oh yeah, I guess I'm a little ahead of you guys.
You got to tell that.
And I'll refer once in a while to, you can go to YouTube. You can watch lectures that I have up for free on YouTube. One is on diabetes. And what it explains to you is actually sugar makes insulin work better. Okay, this was proved by Brunzell in 1972. When his group in Seattle, what they did is they did an experiment on type 2 diabetics. And they fed them 45% of their calories as simple sugar, like table sugar. And then what they did is they doubled the sugar to 85%. Brunzell is his name. every aspect of their diabetes improved. Their 24-hour insulin, the 24-hour blood sugars, the fasting blood sugars, everything improved. And what they said is that sugar, sugar increases insulin sensitivity. In other words, it makes the insulin work better in your body. Now, as you find this lecture and you go through it and you look up the references and see, well, I wasn't joking with you. What you'll find is that fat paralyzes insulin. It keeps it from being active. Anyway, type 2 diabetes is 100% curable. Okay, 100% if you truly have type 2 diabetes. And I want you to watch that lecture. Just put in McDougall and diabetes, and you'll have that lecture and pretty much the full story. Did I get it all?
I think so.
All right.
Perfect. Thank you. Let's see. This is from Rita, can one rebuild bone and gum health through a plant-based diet?
Was it bone and gum?
Gum, yeah.
Well, it's kind of two separate questions. Can the body rebuild bone? Well, we have people who spend a year up in Skylab, okay, floating around without gravity on affecting their bones for a year. And they come down and they'll measure their heel bone thickness. And they'll see that they've lost bone. Why? Because they didn't need all that bone. There's no gravity. And so, they come back and they lost bone. Then you walk them around a little bit and all the bone grows back. Or you may have remembered when you were one of your kids got a broken arm and they put a broken arm in a cast. And then about 3 months later, when they're ready to take the cast off, they took another x-ray and the bone looked really thin. Well, that's because the bone wasn't being used in the cast for 3 months.
But it did grow back together.
Yeah, well, not only did the bone grow back together, but the thinness that you saw on X-ray disappeared. In other words, you remineralize and you re-strengthen the bone. Yes, you can, but you've got to stop the cause of bone loss. The cause of bone loss is the acid-laden rich Western diet. You're sold foods. You're told, look, you need to get protein. More protein you get, the healthier you're going to be. Of course, there's never been a case of protein deficiency ever described. And so we have people focusing on protein. Well, what do you buy? You buy chicken and turkey and fish and beef and pork chops. I mean, what do you buy? It's loaded with protein. Well, protein breaks down into amino acids. There are 20 amino acids that make all the proteins in nature. Amino acids in animal foods have two particularly strong amino acids. They're methionine and cysteine. They break down to sulfuric acid. Okay, so you get all this acid. You create this physiologic acidosis. It's mild, but the body must maintain its pH of about 7.4. So what the body does is it neutralizes the dietary acids, and it does it by dissolving the bones. Everybody in first year medical school learns this. The bones are the primary buffering system of the body. It's not just losing the calcium, actually losing bone material. So that's the first step. The other thing you have to do is get a little bit of exercise, which is really important, safe exercise, and get some sunshine so you don't get osteomalacia.
Now, what about the gums?
Oh, yeah, the gums. Well, again, I've run into a lot of people with gum disease, and you have to do a couple of things. But one, you have to change your diet, of course. So I'm going to sound like a broken record. I'm going to tell you, you got to fix the food first. And then what you do is you see the dental hygienist and have these pockets, debrided the best they can. And then you find some good way to clean between the teeth. And I know many have been talking to flossing. I don't like to floss. I use these little bottle brushes. They're intradental brushes that I put between my teeth, and it works far better for me.
They're called intradental picks, I think.
Yeah,
or brushes.
They look like a bottle brush.
Yeah.
But anyways,
Real tight.
you need to clean this area up, but you need to change your food. Yes, you do. And the bone you lose around your teeth is just like the bone you lose in your spine or your hip. It says chronic acidosis that causes you to have bone loss all over your body, from the top of your skull to your big toe and your right foot. You're living in a bathtub of acid. And once you change that, our diet is an alkaline diet. The McDougall diet is. We have some foods that are slightly acidic, like grains and legumes, tiny, like compare Compare cheddar cheese that has an acid load of 10, which is 10 times more than the acid load in rice, which is 1. So, some of your friends may be well-meaning and say, you don't want to go on that vegetarian diet because it's acid. Well, come on. Compared to what? Compared to cheese, which is 10 acid load, or compared to fish, which is 9, anyway, you get it. And you mix we don't serve just grains and legumes. We serve spinach, which is a minus 56 on the acid load. In other words, it's very alkaline. After you get that minestrone soup made, you're eating an alkaline meal plan, which, by the way, is really important. And, when people have more severe osteoporosis, and I treat them as a doctor, I do a couple of additional things besides sunshine, the right food, and sensible exercise so you don't get hurt, is that I put them on antacids. I can pick any acid. I usually pick Tums, and I have them take 1 to 2 Tums a day because that's an antacid. I could pick magnesium, potassium hydroxide, sodium. Anyway, there are a whole bunch of antacids out there.
Too much.
A whole bunch of antacids out there. Doesn't matter. It's the alkaline part of the antacid that works. It's not the calcium or the sodium or the potassium that makes a difference. It's the neutralizing of these dietary acids. So I do that. Another thing I do is I put people on hormone replacement therapy. Hormones, estrogen always causes bone to grow back. There's some side effects, but considering the balance of harms versus benefits, I make that decision with my patients.
Okay, but what would you do about a man that was worried about bone loss?
Put them on antacids.
Okay.
I wouldn't put them on estrogens. Or testosterone, which is another whole discussion about the hazards of the use of testosterone. Doesn't work the way you think it would work, guys. But it increases your risk of dying of heart disease dramatically. So, yeah.
Thank you. Next question from Ken. Would you suggest not taking Flomax that have been taken for years if I'm completely following the diet you recommend?
No, what you're taking Flomax for is benign prostatic hypertrophy, or prostatism it's called. And what happens as men get older, the prostate enlarges and it closes around the urethra. And Flomax is one of those alpha adrenergic blocking agents that gives you some symptomatic relief. If you stop taking the Flomax, you're going to have the same troubles you had before with urination.
So the Flomax doesn't make the prostate shrink or anything. It just
not permanently.
Just
it helps also suck some of the swelling. There's a whole article on the website on benign prostatic hyperplasia, like 8-page article that I wrote. And so what you do is you do things like you try saw palmetto, which is an herb. There are a couple other herbs out there that's supposed to be good for the prostate. I've never found them that valuable. And then you go on to your alpha adrenergic blocking agents like Flomax. And then you might go on some anti-testosterone drug. We have those, and those are used commonly, a pill for reducing testosterone because testosterone stimulates the growth of the prostate. So the prostate helps shrink that way too and opens up the urethra. And then what you go is you look for minimally invasive surgeries. And they have a few of them out there. The one that I have experience with is, unfortunately, I can't find a place that does it, but it's a
microwave.
Yeah, and microwave thermography, microwave transurethral thermal therapy. Okay, that's what it is. Microwave transurethral thermal therapy, MTUT, something like that. Then also, I think you can still get this done. You can get laser treatment done. But I have actually. Well, I'm getting ready for my 50th reunion for medical school. We've been together 50 years. Graduated 50 years ago. And the fellow I'm in contact with, first thing he said, he was kind of a weird guy anyways. First thing he says is, I had a TURP done, and now I ejaculate my bladder. Come on now. I really didn't need to know that. see what happens in the traditional surgery, and they're still doing it, obviously, because they did them on him. So you got to be careful. What the traditional thing is to take this tube and stick it up your penis, and then they take this knife and cut the prostate. And what happens is one of the side effects is when you ejaculate it back into your bladder, and then you pee the semen out next time you go. And in a high point, I would look forward to.
No, I think that they better just keep taking the Flomax.
But this is a really big surgery. When I was taking care of patients who had this done, they would lay in bed for a week with a catheter in their bladder to stop the bleeding. They get to go home. So try everything else before you do something crazy like my medical student colleague just did. I couldn't believe it. Come on now. I didn't. Well, anyway, I guess.
So Ken might want to keep taking the Flomax, is what you're saying.
Well, you know what? Stop it and then see how things go. If they go well for you, in other words, you don't mind standing there an extra minute or so, then don't take it. I think you should do it based on your symptom relief.
So do you think eating this way would make your prostate shrink?
I haven't seen it, Mary. I've actually seen, in my early days, I've actually seen people who are really, really strong natural hygienists. In other words, they ate a very, very low fat, very vegan diet. And I'll remember one of the leaders of one of the groups that we had in Honolulu. He kept getting into trouble, more and more trouble. And I kept trying to help him. And finally, he ended up in the hospital because he couldn't urinate. And I guess he tried straight casts. It's another thing you can do. You can buy them over the internet.
But there's really no harm in taking Flomax, is there?
Well, I don't know. It's a blood pressure pill.
Oh.
All pills have adverse effects. That's the cost and the idea that you're on medication. So yeah, I don't blame you for wanting to get off it, but trial and error. See how it works out. Now, I'll tell you another thing that works out pretty well is when you get up and pee. If you go for a little walk, okay, you come back and you try pee again. You'll pee again, even stronger. You just take a little walk. Another thing is to drink less fluid in the evening so that you don't have such. The problem is the bladder can't empty. So you leave this residual volume in the bladder. And so now the next time the bladder fills up really rapidly because you only emptied a quarter of it.
And why is that? Because the prostate is large?
Yeah.
Okay.
So anyway, there is help for you. Again, trial and error as far as whether you need it or not. There are other medications like the anti-testosterone medicine you might want to consider if as time goes along, you need some help. And the minimal surgeries, not the ones that make you ejaculate in your bladder.
We don't need to hear that.
So I said that 3 times.
No, that's why I said we don't need to hear that.
I bet I got a reaction.
Okay, next question. This is again from Anonymous. Can I get my lifelong high cholesterol down to healthy levels with this lifestyle if I have familiar hypercholesterolemia? Or should I use a statin?
But there's actually a new line of drugs out for using. People who have familial hypercholesterolemia, especially if you have both genes. What happens is they run cholesterols, in the 800s or 1,000, and they die in their 20s. And you not only use statins, but we have these new drugs. And I should remember. I just took a medical letter on. They have new drugs that are injected, which stop cholesterol synthesis. And if you have real serious hypercholesterolemia that's familial, these drugs will keep you alive. Now, when it comes to a lot of people who say, I think it's in my family. My cholesterol runs 300, 350, 400, and not 800. Then it's a family tendency. It's because what mother, dad taught you like to eat. There may be some metabolic issues that allow your cholesterol to go higher. But if that's what it is, you just have a family tendency, not the real disease, then yeah, you should change your diet. Our cholesterol drops on average are 22 points in 7 days. That's 1,703 people we studied. 22 milligrams per deciliter in 7 days. And it's maintained for a year. We've proven that in 2 studies. So yeah, you should expect profound drop in your cholesterol. And I have people who, I run across occasionally say they just can't take the drugs or they're scared of the statins. Well, Statins are very, very ineffective. You know, they're a big cell with little bang. And doctors are starting to learn that now, how little taking cholesterol medications help. They only help with people who are real sick, like hypercholesterolemia, or somebody who's had a heart attack or bypass surgery. And then you want to add in the drugs. But otherwise, most people out there taking drugs shouldn't be on them. I don't care what their cholesterol numbers are. And you should discuss that with your doctor, that you're being overtreated because they just plain and simple don't work well in relatively healthy people. But we serve you a no cholesterol diet, a starch-based diet with fruits and vegetables. Has virtually no cholesterol. You can eat as much as you want. You'll love the food. If you don't like it already, you'll learn to love it. And then not only does your cholesterol come down, but your triglycerides come down, your blood pressure comes down, your bowel movements get easier. I only say that once.
Okay. Your blood sugar comes down.
Your blood sugar comes down too. And so does your weight. I don't care who you are. I don't care, you know, if you're the worst overeater in the world. You have an eating disorder that would puzzle all the psychiatrists in the world. You switch to a starch-based diet, low fat, and you're going to lose the excess weight. Before 1980, there were 2 billion Asians. Nobody was overweight.
Except for the rich people.
Well, and the sumo wrestlers in Japan, but they ate a special diet. No, but before 1980, they weren't rich people, was the thing, Mary.
Oh, okay.
It was after 1980 that people started watching cable, and they got money. I mean, look at the Asian now. They're driving around Teslas, and you know they made quite a name in the business field. So they can afford to eat the rich foods, and you'll see the modern day Asian, the modern day everything, African, European, you know, the politicians, the business owners, the ones that can afford do go out and have the thickest steak in town. They look pretty sick. Yeah. Anyway, the challenge to you is if you switch to a starch-based diet, cut your food bill. You'll learn to like the foods. If you don't like them already, put a little salt on them. You will lose the excess weight. There were once no fat Chinese, and 90% of their diet was rice.
Thank you. Next question from Rachel. Have you noticed better eye health and vision when adhering to a plant-based diet?
But, you know, I have a reference for that, and you can find it if you go to my website and you look up the Pritikin research papers, Nathan Pritikin. I have, as far as I know, the only copy of those papers. The hard copy was burned up in the wildfire that took our home, et cetera, back in 2017. So this is the only copy that exists. But it's on the website for you to use free. And if you look through his index, you'll find some research that he did or found that talked about how changing your diet got about a 10% improvement in eyesight. Okay, because you improve the circulation to the eye. I can't, except for that particular research paper, I can't say a lot more about it. I haven't looked up the studies on it lately. But one thing you run into is particularly in people who are diabetic or even people without diabetes, whose blood sugars run a little bit high, is the sugar gets into your eyeball and it draws water in. And thereby it changes the size of the eyeball. Okay, and when you change the size of the eyeball, you change the focal length between the lens and the retina. And so, you know, I have diabetics who will, you know, they'll tell me, well, almost all my glasses don't work, or you know, or my diabetes is gone. Now I got to go get new glasses. It's because of the osmotic change that takes place in the eyeball when you have, you don't have to be frankly diabetic. I mean, the average person, when they switch to our diet, they change their blood sugar levels. And so, you know, you may have a minor change in focal length. Cataracts are caused by the Western diet. If I had to pick on one thing, it would be galactose, which is the milk sugar. It's a breakdown of the milk sugar lactose. It comes from dairy. And so there's a condition called hypergalactosemia. And this is a genetic defect where people run very high levels of galactose in their blood. And one of the classic signs that happens in their teens and 20s is they develop cataracts. they go blind. And so they get this galactosemia. Well, lactose breaks down into galactose. So you're being chronically poisoned by dairy products as far as cataracts are concerned. Glaucoma, there's another eye problem that we know it responds to change of diet. We measured people's either pressure tests. They have blow a little bit of air into your eyeball and see what the pressure is. And we see dramatic improvement when people change their diets, just like high blood pressure. High eye pressure changes. And, the way you find out whether you need to stay on the drops or whatever medication you're given is you go see the ophthalmologist. You say, take my eye pressure. And he says, it's like 22, got to be on it. Okay. And you go back maybe 3 months later, 6 months later, you say, well, check it out. So, well, it's down to 16. Okay. Well, that's normal, isn't it, Doc? Oh, yeah, that's normal. Well, how about if I cut the medicine in half or stop taking it altogether? And I'll come back in a few months, you can check it again. Because you don't want to stop the medications and not monitor your success. Because glaucoma can result in early blindness. So I just gave you a whole lesson on eye disease, more than you asked for.
Thank you. I love it. I always learn something from these chats. It's so great. Okay, now, Mom, question for you. What's your favorite go-to recipe that you never get tired of?
Oh,
There are lots of those. We had one last night.
yeah. No, that's not even a recipe. That's just baked potatoes and broccoli. My favorite, well, probably the creamy golden gravy.
That'll do it.
Because I can make that, and we put it on everything.
You can put it on anything. When we used to
Potatoes,
run
rice.
When we ran a clinic in Santa Rosa, people would just dump it over everything. This creamy golden gravy, and boy, it's really, really good.
I think that's a really easy one. The other one is edamame surprise.
Well, see, you went from sauce to a meal, right?
Yeah.
Okay.
I mean, I'm trying to give them two options if they want a meal.
How do you make the edamame surprise?
With frozen edamame or frozen lima beans, some cooked brown rice, frozen corn, some shredded cabbage, and just a little seasoning mixture, and that's all.
I really like that too.
I know you do.
But I would say that when we got them off the counter, that maybe we didn't have them tonight. Mom had been thawed out. She's got some beans that she made in a slow cooker 2 or 3 days ago, and we had a bowl of beans and rice. She got the rice out of the package, and put the bean. You can get the beans out of a can. And you put them in a bowl, and then tell them what else you did, Mary.
Well, and I put some salsa on them, and some black olives, and some thawed corn kernels, and a little avocado, and some more salsa, and we just ate a huge bowl and that was really fast.
Yeah, and Mary will make either pizzas, bean pizzas, or enchiladas, bean enchiladas with the beans that are sitting on the counter. Or we may end up having tonight just another bowl of beans. But I found this new great mango salsa in Fred Meyer's, which is Kroger's. And I'll tell you, mango salsa, I can put it on anything and eat it. Yes, you need to find a few favorite spices or steak sauces, or that don't have any oil in them. And a little sugar and a little salt is going to make it go much tastier. And find the starch you like best and put it over the top. And one thing I want to mention before, I haven't mentioned enough, and that is that when you do this, things are going to change profoundly. Your blood pressure is going to drop. Your need for insulin, your need for diabetic pills will drop to the point where you might fall over into your mashed potatoes with the hypoglycemia or low blood pressure.
So you make sure you have a doctor to work with, right?
Yeah, I think so. And I'll try to remember to say that so we avoid any problems on the show every time, is you should make these changes under medical care that knows about diet. That's the hard part, is to find anybody interested in knowing about diet. So do that. We have a success rate. It's published. It's in the journal Nutrition. And it's on 1,703 people, where we were able to, over a 10-year period of time, we were able to get nearly 90% of our participants off their medication, particularly their high blood pressure and diabetes medication. this is the only program in town that believes that sick people take drugs, and that the goal is to get you off the medication. That's what we spend our time doing. Of course, we have board certified doctors that take care of you, work with you, well trained. I've trained them, and you can do it. You can get your health back. You can do it in your community. You can have your local doctor monitor you. You might get a little frustrated, but we, of course, would encourage you to get involved with us. We love
Absolutely.
what we do.
We do. We have a great team. Okay, let's see. We've got a few more minutes left. I'll try to fit in a couple more questions. Any suggestions? This is from Chris. Any suggestions for diverticulitis?
Yeah, as soon as you change the diet. This is an infection, usually in the large intestine, usually on the left side. And it's an infection of diverticuli, which occur as a consequence of having a lifetime of small stools because you ate a low fiber diet. And these diverticuli, which are like little balloons, like an appendix, little balloons sticking out of your colon, they get compromised, and it's due to the food that is in there. It's not due to little seeds, which you're told it's due to poppy seeds. No, it's just nonsense. Anyway, the opening for the diverticuli gets plugged, and then it gets infected. And you have diverticulitis. And when you're sick with diverticulitis, you need to have maybe some antibiotics. That's pretty standard therapy. But if you don't want to get it again, the chances, if you eat a good diet, you put that good stuff in the large intestine, you're never going to have another attack again.
All those starches like potatoes and rice,
Yeah, that
and
kind of stuff.
pasta.
And beans and peas and lentils
Yeah.
and bread. And again, you know this. You know this. Just look around you. Look at a little history. The people who lived on starch-based diet, which is 99% of the people, 99.99% of the people who walk this earth have lived on starch-based diets. Corn in Central America, rice in Asia. You know this. You've seen it. You've seen what happens when people become rich. If you're tired of looking like an aristocrat, a king and a queen, suffering from diabetes and gout, and, coronary artery disease and bypass surgeries and a handbag full of drugs, then you need to learn this. The body doesn't want to be sick. It wants to be healthy. You got to give it a chance.
Absolutely. All right, we've got 2 minutes. Last question that I think would be good to wrap up with. Do you recommend any vitamins or supplements?
Except for B12, no. And it's not just a casual recommendation. Some of my mentors, and I suppose, say it once in a while, says you're just peeing your money in the toilet with vitamins, but it's more than that. When you take vitamins such as beta carotene, vitamin E, in fact, the Journal of the American Medical Association just came out with an article in a position paper last month in June. Said June, yeah, 2 months ago. In June, you look it up. That condemns people taking beta carotene and E. That'll do you terrible harm. They say it right there in the pages of the Journal of the American Medical Association. What happens is these cause nutritional imbalances and increase your risk of death, heart attacks, and cancer by about 20 to 30%. You don't do that. B12 is the exception, and we do add B12 to the diet. We'll learn about that a little more next time.
Great. All right, well, the hour is up. That was lots of fun. Thanks, Mom and Dad, Dr. McDougall and Mary.
It was fun.
I just want to summarize this 5 o'clock evening thing is a chance for me to get together with you, and it's a chance for you to bring friends and relatives who want to see who these McDougall people are. What are they going to do to me? I think if you bring some of them over to take a look at us and see what we have to say, they might. And I know it's been hard for you to get them to change. And we'll be answering your questions. And of course, one thing that we're going to encourage you to do is take advantage of our 12-day internet broadcast where we practice medicine over the internet.
And this program will be on our YouTube website, right, Heather?
Yep.
Going
Right on our YouTube channel.
Okay.
So anyway, if you need the right doctor to take care of you, there's Dr. Lim and myself, and we'll make sure you get the kind of care that you deserve. Otherwise, go out and ask your local doctor to help you. Or, if your local doctor objects to anything you have to say, you tell them 5 o'clock Pacific time. every Sunday I'm here, and we'll give them priority.
That's great. Thanks, Mom and Dad, Dr. McDougall and Mary. Thank you, everyone, for being here. See you next Sunday at 5.
Okay.
Okay,
care.
bye-bye.